Well, now it's Arizona to be the latest state to challenge the new healthcare law as more and more local governments say they simply can't afford the costs of the plan.
Yeah, so what do the rising legal battles mean for employers who are busy trying to formulate their 2011 healthcare plans for workers? It's a mess and getting messier. Well, joining us from Kansas City this afternoon, Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. And Doctor, thank you very much for joining us. Let me begin with just that point. How do businesses plan for next year and their employee costs when it's a mess that's getting even messier with all these lawsuits?
You know, Ashley, many employers are still trying to figure out whether they should stay in the game, and at least for next year, many of them temporarily are. But the greater challenge is whether they should just abandon covering benefits for employees and just pay the penalty, because the premiums are going up and there's nothing in sight that's going to control their cost, and that's the biggest challenge. And they're sort of caught between a rock and a hard place, because if they don't provide coverage, they're going to have to pay the penalty, but they're also not allowed to provide too much coverage. And so they're really stuck between these two places, and employers are lost. They're trying to scramble right now in terms of how to be compliant.
Doctor, you're saying almost definitively that costs are going to go up. Yet we just had the CEO about a week and a half ago of Perkin-Elmer, where they do all kinds of diagnostic and health testing. It's more preventative. Their earnings are way up because companies are looking ahead and saying, easier now to look to preventative types of offerings and medicines and healthcare options than wait till people are at their sickest point. Isn't this actually a good thing that eventually might bring costs down for businesses?
But there's an upfront investment, Liz. It is a good thing to invest in prevention and wellness, but there is going to be an upfront cost to that. So whether it's employers, insurance carriers, and even the government is providing some incentives to some extent to really promote that. But we have to recognize that you are going to have to pay for that up front, for the idea that costs later on will be controlled.
Well, Doctor, you know, the White House argues back that everybody needs to be in the system in order to help pay for those individual mandates that are creating all these lawsuits. Is there any merit in that argument?
They need to be in the system if the insurance carriers are going to cover their losses. Because with taking on the dependents under the age of 26, with the people with the pre-existing conditions, the insurance companies are really rattling the cage and say, look, we need people in the system so we can make up for this. But this is where the states are coming in, right? You've got Virginia, you've got Missouri, you've got now Arizona coming back and saying that, look, this oversteps the bounds of what the government is allowed to enforce. But the real hidden message here is that the states are really concerned. They're afraid they're going to be left holding the pot because they simply don't have enough money to sustain Medicaid. They don't have enough money to support these insurance exchanges. It's a big deal. Today, the government released $45 million for 45 states to help them hold insurance companies more accountable. If you look at $1 million per state, that's hardly a drop in the bucket.
Yeah, it's going to
hardly a drop in the bucket.
It'll be very interesting to watch this develop. But again, a lot of these effects of the healthcare plan don't kick in for another couple of years, so it may take a while to shake it all out. Doctor, so good to see you. Thank you so much.